Okay, so if I can get everyone's attention back up here, I will go ahead and start talking about pain. I'm going to talk about ways of coping with pain, and I'm going to start out giving a brief overview of what we know about pain in NF, and then I'll talk about various approaches to pain management, including medication, physical activity, and acceptance and commitment therapy, which is the type of therapy we do at the NIH. So if we look at the literature on pain in NF, you'll find surprisingly little out there for how common of an issue it is. What we do know from, this is a study that came out of our research group at the NIH a few years back that suggested that pain is reported in 53% of youth with NF1 and plexiform neurofibroma tumors. There's less information about pain in adults with NF, but the common causes include the PNs, scoliosis, chronic headaches, and a variety of other things. In schwannomatosis, 68% of adults with this disease report chronic pain, and this is often due to the neurofibroma tumors. And when I work with someone with pain, I think it's important to not just ask about how severe their pain is, but also how much their pain is interfering with their daily life. So that's something I'm going to keep touching on during my talk. So at the NIH, there's a very large natural history study that we've been doing for quite a few years now, led by Dr. Brigitte Wiedemann. And so I'm going to mention a few things that we've learned from that trial. It's comprised of youth from young children through young adults with NF1, most of whom have plexiform neurofibromas. And there's good news and bad news from that. The good news is that 45% of adolescents and 33% of children with NF1 are reporting that they don't have pain that's interfering with their functioning. The bad news is that those are the numbers of individuals who say that pain is interfering with their functioning, and that's a good number there. We also assessed what kind of medication these individuals were taking. The majority were not taking any medication, either because they didn't have pain that was bad enough to warrant meds, or they didn't want to deal with the side effects. 30% were taking some kind of prescription medication, sometimes in combination with over-the-counter meds, but these included things like opioids, like morphine, anticonvulsants like Neurontin and gabapentin, and some others, antidepressants, and a couple were using the lidocaine patch. A very small number were only relying on over-the-counter medication. But perhaps one of the most striking things from this data is that of those patients taking pain medication, 93% were still saying that they had pain that was interfering with their functioning, at least somewhat. So obviously for many people, pain medication is not adequately managing the pain. So then we're starting to look at what else can we offer people who have pain but aren't getting relief from medication. So I'm going to talk about some active approaches to pain management beyond medication, the first one being physical activity. We know from the literature that exercise has shown to improve pain and functional capacity and to reduce fatigue in adults and children with chronic pain. But of course, any exercise regimen has to be balanced with the individual needs of the person and any limitations that they might have. I work with a lot of children and teenagers with NF, and their parents would say, well, my kid has tumors. They can't go out and join a soccer team or run track because of the very real limitations they have. And so we're starting to look at other options for physical activities, such as yoga. This is something that is perhaps more doable for a lot of people who might have tumors or other limitations from scoliosis and so forth. So to give you an idea about what's been done in the literature and the research from yoga, A recent review of 6 studies of adults with chronic pain who did yoga found that the results overall favored the yoga group for pain reduction, especially in the short term. We really don't know yet about what the long-term benefits are. There's not enough data yet. In children as well, we found that, or others have found that after 10 yoga lessons, children with chronic abdominal pain were reporting significantly decreased pain, and parents were reporting better quality of life in their children. But more research is needed in this area, and there's no studies out there looking at yoga in NF yet. Now, we were really interested in physical activity in youth with NF1, and in the future we're going to be developing an intervention for that, but we so far have just done a survey study where we assessed, we gave questionnaires to youth with NF1 and plexiform tumors and their parents. And what we found is that 70% of the samples spent at least 2 hours per school day in sedentary activities, so things like watching television and playing video games. Does that sound familiar to anyone? And then we also found, we asked how much activity they were doing, and what we found is that the more physical activity that the kids were doing, this was related to better self-reliance, less hyperactivity and inattention, a lower sense of inadequacy, and less pain interference. So clearly that says to me that there's room for an intervention here, and we need to look into this more. And now I'm going to move into acceptance and commitment therapy, which you've now heard me and Dr. Coyne both reference as something that we do a lot of in our work. And in fact, I've learned a lot of what I know about ACT from Dr. Coyne. So we know that ACT is effective with a variety of conditions, including chronic pain. It's got, if you look at the studies on ACT with chronic pain, it's got a very impressive resume in terms of how effective it can be with various pain populations, including arthritis, neuropathic pain, and others. And that what it does is it significantly improves pain intensity, depression, pain-related anxiety, and quality of life. So ACT is a little bit different than a lot of other types of treatments for pain. And that's because the goal of ACT is not to eliminate a person's pain. The goal is to help the person have the best life they can live, even while living with their pain. And some of the concepts, this will be a very obviously brief snapshot of what ACT is, but hopefully it'll just be enough to give you some ideas about it to take with you. So some of the key concepts are mindfulness, willingness, and values, and I'm going to talk a little bit about each of those. So can I see a show of hands for any of you who were in the mindfulness session yesterday afternoon? A few of you with Dr. Franciano, and Dr. Coyne and I had a few of your kids in the kids section as well, which was a lot of fun. And there's a lot of talk about mindfulness in the social media these days. What it is non-judgmental, moment-to-moment awareness. We spend so much time in our heads in the past, thinking about what happened yesterday or last week or 10 years ago, or in the future. You know, what are we going to do tomorrow? What's for dinner tonight? And what am I going to do about that problem at work next week? And the problem with that, sometimes that's necessary, but the problem can be that when you're in the past or the future, you're missing what's happening in the present moment. And so mindfulness really helps people learn how to be present in the moment. And I'll talk about how that can be really helpful for pain. So how do I do it? Well, when a lot of people hear mindfulness, they think meditation. And a really great cartoon for meditation is this couple meditating, and the woman is thinking, meditation is too hard. How do you keep one thought in your mind for this long? And the man's saying, dinner, 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 dinner. And so that's one way of meditating, is to sit in a room quiet and try to focus on just one thing, but it doesn't have to be that. It can be a lot of other things. And mindfulness can be something like mindful breathing, which is just focusing on your breath and nothing else. And that sounds simple enough, but it can be really challenging. So I actually want to try something with you, if you're willing now. I want to try 30 seconds of mindful breathing, and I'll time us. And when I tell you to start, what I want you to do is simply to focus on your inhaling and exhaling and how the air feels as you inhale and exhale. If you notice a distracting thought enter your mind, just gently focus back on your breathing. And I'll tell you when the 30 seconds are up. Okay? Go ahead. You can close your eyes if you'd like. Okay, so that was about 30 seconds. You can bring your focus back to the room. And I just want to ask you, did any of you have a distracting thought during those 30 seconds? Did any of you find your mind wandering? Yeah, a lot of you, and that's normal. It's hard, but the fact that you were noticing, that you noticed those thoughts, that's being mindful. And when you practice mindful breathing, you get better. It's like a muscle. You got to work it. And so you get better at being mindful on your breathing for longer and longer periods of time. You can be mindful in your daily activities. Almost anything you do, you can do mindfully or not mindfully. So you can brush your teeth mindfully by noticing the smell and taste of the toothpaste, the way that the bristles feel on your gums. How many of us really notice those things when we're brushing our teeth? Not often, right? We can do that mindfully. We can wash the dishes mindfully. We can pet our cat or dog mindfully. We can be mindful or not mindful when we interact with the people that we care about. We can have dinner with our partner or spouse mindfully or not mindfully. So what might that look like to have dinner with your partner not mindfully? It might look like that, right? What might it look like to go to the playground with your kids and not be mindful? That mom's on her phone, and look at those poor kids. They're just sitting there on the swings, not moving. Now, don't get me wrong. I love my iPhone. Ooh, I'm sorry. That was right into the microphone. So I love my iPhone, but I really try to notice. I'm struck sometimes by how often I'll go to the playground with my kids, and so many of the parents are just on their phones, and we're missing out on the people that we love right in front of us when we do that, and I'm guilty of it too at times. So I want to do a little experiment with you now. I would like everyone to hold your right arm out in front of you. And I want you to think about how heavy it feels right now. And think about how it's already maybe starting to hurt in some places and how bad it can hurt after just being here for a few seconds. We haven't been doing this long, but my gosh, it's already really uncomfortable. And you're probably thinking, man, how long is she going to make us do this? This is really awful. I don't like this. And I'm starting not to like her so much, maybe. You can put your arm down now. And now, let's do something a little different. Let's hold your left arm out in front of us. And this time, I want you to notice if your hand is shaking, if you can keep it really still, or if it's kind of shaking out there. And notice if there's one part of your arm that feels heavier than the rest of it. And if you're starting to feel any discomfort at all, notice where the discomfort is. It's not in your entire arm, is it? Maybe just in a part of it. Isn't that interesting? And now you can put that arm down too. And we were holding out our arms about the same amount of time. Did anyone have a different experience between the right and the left? Was it a different experience for anyone? What I was trying to do is demonstrate how in the first time I was trying to get you guys to get all tangled up in your thoughts, like, the anxiety and the frustration and the pain. And the second time I was trying to get you to just notice with a little more distance, observing with curiosity and mindfulness what that experience was like. So hopefully that was helpful. So mindfulness, as I tried to just demonstrate, can create distance between us and our thoughts. It can help remind us that words are just words, thoughts are just thoughts. Don't believe everything you think, one of my favorite sayings. And when I'm working with someone with pain, the way that this is applied is a lot of people with pain tell me, they have kind of their behavior that they do when they start to feel pain. Like people will say, when my pain gets to maybe a 6 or a 7 on a scale of 1 to 10, I will take my pain medication, or I'll get grumpy with my family, or a lot of them say, I will go to bed. That's just what I do. And it becomes so habitual. You really becomes part of your routine, so we may not even think about it. And there's not much space there between the pain and the behavior. It's just, I feel pain, I'm going to do this. What mindfulness helps us do is create some space between these two so it looks more like that. And in a few minutes, I'm going to talk about what that opens up to and why that's important. But now I'm going to move into willingness. When we talk about willingness in ACT and with pain, we're talking about, are you willing to have a certain amount of pain in order to live a fulfilling life? And so we have a questionnaire that measures willingness. And we give it to a lot of our adolescents sometimes. And so one of the items that is kind of representative of low willingness, unwillingness, is keeping my pain under control is the most important thing whenever I'm doing something. A parent who had low willingness or low tolerance for their child's pain might endorse this item. Symptom control must come first whenever my child does anything. Now, someone who was high on willingness, who was willing to experience pain if it meant doing something important, they might agree with this statement. When my pain increases, I can still do things I have to do. For parents, it's possible for my child to live a normal life, even though they have this chronic illness. And I know it might sound a little weird. Are you willing to have this pain? You're like, well, I have it whether I'm willing to or not, right? But it's kind of more of an attitude. Yes, you have it, and so then what, right? And so we know that people who are higher on willingness, that have chronic pain, that's related to reporting less pain, lower impairment related to their pain, lower pain anxiety. And so the question I ask people that come to me is, what are you willing to have in order to live a fulfilling life? And I have a pencil up here with me that I'm going to use. I'm going to ask for a volunteer to come up. And if you volunteer, I'm going to ask you to hold your hand out so that I can stab you with that sharp pencil really hard. Does anyone want to come up? No? Really? Okay, well, no, that's okay. You can put your hand down. But what if this? I know this is a silly question. It's hypothetical, of course, but just work with me here. What if I told you that this is a magic pencil, and that if you let me stab you in the hand with the pencil, the magic pencil would cure NF worldwide today? I know it's a silly question, but if that were true, would anyone let me stab you with the pencil if that were true? I would be stabbed. And why? Well, do you see how your willingness to experience pain shifted so quickly when it was in the service of something you care about? When it's in the service of something that's really important to you, you're willing to experience more pain, right? So that's kind of what we work with there in willingness. That's what it means. And that brings us to values, the last part of ACT. Is Tracy Ann here? Is she going to give me a five-minute warning when it's 5 minutes, okay? So values in ACT means who or what is important to you. And to illustrate this, I'm going to mention a little girl that I worked with that I'm going to call Maddie. And to Maddie, what was important to her, aside from the typical teenage stuff, was art and school. Now, a little more about Maddie. She was 13 and she had a large plexiform tumor on her right arm. And it would start to hurt at school after she was writing in her classes. And so she would tend to then go to the school nurse and miss out on some other things in her classes. At home, when it was hurting, she would skip her art class because of the pain. So we worked together for a while on mindfulness and willingness and values. How's my voice doing? Okay, I'm going to get through this. So for Maddie, if we go back to this diagram, what she would tend to do at first is when she had pain, go to the nurse and skip art class. After a while of working together, that turned into that. And so I told you I'd get back to why is that so important? And now I can show you that when we create space between pain and those behaviors, now we have room for this possibility, and that possibility, and that, and that, and that. All things that were important to her. All of her values. And there may have been times when the best thing that she could do when she had pain was go to the school nurse or skip art class. Sometimes that might have been very appropriate, right? But there might have been other times when maybe one of those other things could happen. Okay? So one last visual, because I love visuals. Which red circle is bigger? Okay, you guys are smart. They're the same size. Yeah, okay. My technical skills aren't that good with this, but can you see that kind of, it's supposed to be like an optical illusion, can you see that the one on the left is supposed to look bigger because the circles around it are smaller, right? Now, what if the red circles represent pain? And what if the outlying circles represent values? This is to demonstrate that the more those values, the things that are important to you, the more space they take up in your life, the smaller pain looks by comparison. Okay? Still the same amount of pain, both sides. And when I'm working with someone, what I really want to have happen is this. If I can get someone to get their life looking like that, that's what I go for. So I want to just mention the research study that we did the past couple years at the NIH with adolescents with NF1 and chronic pain. We had them come to the NIH for a 2-day ACT workshop with their parents, and we had them do questionnaires before and 3 months later. We had a total of 10 adolescents and 6 parents return their follow-up questionnaires. It's just a small pilot study to see if it was feasible before moving on to a bigger study. What we found was that the extent to which pain interfered with their functioning significantly decreased. Their pain intensity decreased. And for the parents, their willingness to tolerate their child's pain increased. And that was not statistically significant, but we only had 6 parents, so I think with more parents, we probably would have seen statistical significance there. But the data shows that there was some good movement there. And so what we learned from that is that ACT may be a feasible option to supplement and maybe in some cases replace pain medication. And then it may help parents tolerate their child's pain better. Well, we need more research. I think this could be helpful in individuals with families with NF2 and schwannomatosis as well. And we don't see much of those patients at our clinic. And so that is leading up to the study that we're gearing up to start this summer at the NIH for adolescents and young adults ages 16 to 34 who have NF1 and plexiform neurofibromas and chronic pain. If people are found eligible and are interested, we're going to have them come to the NIH for about a 2-day visit where they'll do questionnaires, get an EKG to measure their heart rate, and they'll have two-hour sessions with an ACT trainer. And then they'll go home and have weekly emails with ACT exercises, bi-weekly video chat sessions, and then they'll come back for follow-up. It's randomized, so half the people will get the intervention right away, half the people will get it after 2 or 3 months, but everyone will get the intervention. So if you're interested in learning more about that study, you can either see me later, or I'm going to have my contact information and a handout that Trace Ann has back there. So feel free to email me when you get back home if you're interested in learning more. These are just the people that worked with me on the pilot study that I just wanted to acknowledge. And now a picture of my values, 2 of my wonderful values. And that's what I'll leave you with. So thank you.